It's 2:20. All right. Good afternoon and welcome to Super Bowl Sunday, Arizona American College of Cardiology fellow Jeopardy competition. As you all know, the Jeopardy program was started what 10 or 15 years ago at ACC, and I think it's been recognized as a phenomenal way to engage our fellows in training who will collectively be the future of cardiology. And it's a national level competition, and this is our state level competition to decide on the winning team, which will represent Arizona at ACC Nationals coming up in April, right, Liana? I think it's April.
Yes, April 2nd and 3rd in Washington, D.C.
Washington, D.C. So it's really inspiring to see representation from all 4 of the fellowships in Arizona. And the degree of engagement and enthusiasm has really been infectious and fantastic. We have 4 teams with us today, as mentioned, from University of Arizona Banner Phoenix. We have Malik, Muhammad, and Anas. And from Mayo Clinic, Arizona, we have Timothy, Senthil, and Justin. And then from Honor Health, we have Lydia, Juan, and Krishna. And finally, from University of Arizona Banner Tucson, we have Nanda, Julia, and Jeffrey, who will be representing the respective hospitals. And I see we also have some guests today who hopefully will be cheering us on silently within the chat group, right? You can say whatever you want and wave or to support your teams. We also have a special guest with us today, Megan Pelter, who is the ACC Fit representative from Southern California, who has been a fantastic advocate for her California teams. I spent the last few weekends with them deciding their representing California team, and UCLA won yesterday. Their team is very strong, and they have a long history of having a phenomenal team. And so hopefully we'll be able to train our Arizona teams up to be able to go head-to-head at some point. So with that, I think we're going to get started now. We've already reviewed the rules with all of the teams, and the buzzers have been tested. And hopefully this will be our last Zoom Jeopardy event. I hope. This is the end of. Maybe we can do it with masks or something, but. A lot of the fun has really been in the past years being able to simply get together, be in the same room, and meet each other and exchange ideas, etc. So this has been a strange compromise, for the pandemic years. This will be my last year as ACC Arizona governor, and this is my last 2 months actually. I will step down in April at the Nationals and hand over to Wilbur Sue from Banner Phoenix, who is our director of electrophysiology. I know he's going to be fantastic, and I'm looking forward to also continuing to support ACC both at the national and Arizona state level. So this is probably my last event. Thank you all, and it's been fantastic. So let's get going here. I'm going to get the screen up and then we'll share screens. I have not been able to get past Zoom technology when it comes to the music. My son explained this to me today, but if I play the Jeopardy macro actually has music on it, but because it comes from the same computer, Zoom actively suppresses any sound that's coming from your computer. And that's a fascinating fact. I had no idea that this was true, but so you won't hear any music from and Liana will have to hopefully come up with. So this is our board. I'm going to share that. Can you see that, the board?
You can see everything.
Oh, okay, good. Right. Yeah, somebody's playing
Liana's
music,
got
not
the
me.
music. Liana's on top of it.
All right. You know what we did not do earlier was we did not choose a starting team. So let's do that. Okay. I'm going to write a let me see how are we going to do this? There's 4 of us. So we can't do a. Okay, I suppose what we'll do is this. I'm going to pick a number between 1 to 100. And then the 4 teams can say, I'll write it down. And the 4 teams can say whatever number they want. And the number that's closest will get to go first, okay? So I'm going to write this down right now. Writing down. Okay, Tucson, what's your number?
Can we go last?
No, it doesn't make any difference.
We'll do 50.
50, okay. Honor Health, your number?
77.
77, okay. Mayo?
78.
78.
78, okay, all right. And what's it called? Phoenix?
40.
40, okay, so Phoenix it is. My number was 33. 33. All right. All right, Phoenix. Olivia, are you ready to score? Where did Olivia go? Yes? Okay, good. Yeah, she's silent. All right. So Phoenix.
All right, we'll go for drugs for 100.
Okay, drugs for 100. Okay, a 78-year-old female presents outside hospital with chest pain and 2 millimeters ST elevation. She's 4 hours away from the nearest PCI center. The decision was to give the patient fibrinolytic therapy and transfer to the nearest center. The patient is given aspirin, 81 milligrams. This is the dose and the additional antiplatelet therapy indicated. So we need the dose and the name of the medicine.
Honor Health.
Honor Health?
Honor Health.
Sorry,
Yeah.
75 milligrams of clopidogrel.
Okay, Honor Health, that is incorrect only because you have to answer in the form of a question. This is Jeopardy.
No. Oh, I'm sorry, Krishna and Juan. I am so sorry.
Okay, no worries.
What is
Yeah, luckily we're only at 100, so that's great. It's a good way to get started. So color for teams, Honor Health, maybe we'll do you as a team, the little brown thing over here. Let me write that down as well, just so I get this right. So Honor Health will be brown, team 7. Maybe we'll make Mayo team 5, blue, right in the middle. Phoenix gets to be yellow, team 3. And Tucson will be pink or salmon or whatever that is, team 1. All right. Okay. There we go. All right. Back to the board. Oh, sorry. We were supposed to go back to the option for another. The option for the other team to answer. I messed that one up too. Okay, so there should have been an there should be an option for another team to answer. I apologize. It's confusing when you have 4 teams on the board. So
No,
we'll not go. Yeah. So for that error, Honor Health, you continue to have the board. Oh, sorry. No, Phoenix. Phoenix has the board because Honor Health got the answer wrong.
All right, we'll take 200 for the same category.
Okay, 200 for the same category. Oh, this is the daily double. So Phoenix, as a reminder, you have to wager and you have to answer the question. Your maximum wager for today is $400 because right now you have no money in the bank, but it's the maximum available on the board. So, and you must answer the question and the board will remain yours at the end. What is your wager, Phoenix?
All right, you ready?
Yeah. What? How much would you like to wager? Maximum.
Do you have to tell that right now, or do you have to write it down?
No. You have to tell it right now.
Oh, okay, 100.
100. Okay. We've got 100 going here. All right. This medication is commonly prescribed for claudication symptoms. However, should not be used in heart failure due to inhibition of phosphodiesterase. And I'm turning the timer on now.
What is silostazole?
That is correct. All right, good job. So there you go, 100. Fantastic. All right, Phoenix, you still have the board?
We'll take 300 in the same category.
Why not? This is the preferred SGLT2 inhibitor to be used in a patient with type 2 diabetes and atherosclerotic cardiovascular disease?
Tucson.
What
What's
is,
the dapagliflozin?
That is incorrect, Susan. The other teams have an opportunity to buzz in.
Well,
Would it-
the next one that buzzed in was Phoenix.
Okay, Phoenix.
What is empagliflozin?
Yeah, that is correct. Yeah. So this one is a bit slightly controversial because the new ACC practice guidelines actually don't differentiate between the four. But overall, if you look at the data in entirety, empagliflozin has been shown to decrease atherosclerotic cardiovascular morbidity and mortality in patients with type 2 diabetes. But so have the others. But there's a bit of haziness here. But empagliflozin is the nationally chosen answer. Okay. So that was back to Phoenix, right? Did I give the points, by the way?
Hold on.
No.
Yeah,
No.
you need to give Phoenix the 300.
Got it. Right here. All right, good. All right, empagliflozin. Now we're going back to the board. All right, Phoenix.
We'll go for 400 in the same category.
Okay, good. This is a mechanism of action and the class of drug of mavacamten, which has shown in the Explorer HCM trial to improve exercise capacity, LVOT obstruction, and NYHA functional class in patient with hypertrophic or with obstructive hypertrophic cardiomyopathy.
Honor Health.
Go ahead, Honor Health.
What is a myosin inhibitor?
Yeah, that is correct, Honor Health. Yeah, what is the cardiac myosin inhibitor? We'll put this up here. All right, good. Honor Health, it's your turn. You have the board.
Quan, it didn't register.
You did 300, no? It was minus 100 and it was 400, so then it became 300.
Okay.
Thank you.
Yeah, so your board, Honor Health.
Okay. Honor Health is going to choose living with HIV for 100.
Okay. This risk factor for development of heart disease is noted in half of patients over the age of 50 taking antiretroviral therapy.
Tucson.
what is dyslipidemia?
That is close but incorrect.
Honor Health.
Timer is on, Honor Health.
What is coronary artery disease?
That is also incorrect.
Mayo.
What is hypertriglyceridemia?
That is also incorrect. All right, so anybody else? Phoenix, you want to jump in or no?
Phoenix.
No. Do you want to jump in or no? Did they?
They buzzed in.
Okay, they buzzed in. Phoenix, go ahead. Phoenix, you have the answer.
Yeah.
Oh,
What is atrial fibrillation?
No, that is incorrect.
Hyperlipidemia,
bro.
Yeah. All right. So that was a great equalizer. So the answer is hypertension. Yeah. Honestly, I thought it was hyperlipidemia as well, but it's not quite as high. Good try. All right. So the same people, nobody got that right. So I think it was Honor Health that still has the board right. Honor Health.
Okay. Honor Health is going to choose old school hemos for 100.
Old school hemos for 100. The hemodynamic effects of milrinone include the following: increased cardiac output, increased heart rate, and this effect on systemic vascular resistance.
Tucson.
What is decreased systemic
Yeah.
vascular resistance?
Yeah, that's correct. Okay. Tucson, you have the board.
We'll do same category for 200.
Oh, can you hold on just a second? Sorry, we're just having buzzer issues.
Okay.
What's the website, man?
Let me know when.
Do you want to hold the timer for this little break?
Yeah, Olivia, maybe what we'll do, given the little glitches here is, well, let's just finish the board. We'll leave it off time and then we'll switch over. So
Yeah.
forget the 15 minutes.
So we just had a quick question as regards to that double. That I think the question that we answered that was double. I'm sorry, I can't remember the name, but do we get because we wagered 100? Do we get doubled for that or
No,
just 100 straight up?
No, just 100 straight up.
I see. Okay.
Yeah, we switched phones, so I think it should work. Should
Okay.
we try it once or are we good?
Yeah, try it once.
Try it once. Okay. Well, on 3, 2, 1, go. Okay. 3, 2, 1, go.
Mayo, Tucson, Phoenix, Honor Health.
Okay, good. So Tucson chose $200. We are going now. Distinguishing between severe aortic stenosis and hypertrophic obstructive cardiomyopathy, this is the invasive sign seen on simultaneous LV and AO pressure post-PVC.
Tucson,
What is broken burrow Brunwald phenomenon?
Yeah, that's correct.
Yeah, nice. All right. Good
Yeah,
job.
this is a classic question. I'm not even going to it because it gets asked so many times. All right, Tucson.
Same category, 300, please.
Okay, I'm going to read this very slowly. All right, and I'll start off with the saturations. The aortic saturation is 92%. The LV saturation is 92%. The SVC saturation is 70%. The IVC is 78%. The RA is 86%, and RV is 86%, and PA is 88%. I'll read the question now. 22-year-old female with hypoxia was brought to cath lab for right heart cath and shunt study. We know her QP-QS ratio is this value. I'm gonna put the timer on. I suspect people may not want to try this. All right, so I'll take that as no one buzzed in.
no one
All right.
buzzed in.
Yeah, so it's QPQS of 2.0. You have to remember the FLAM equation for this specific patient, right? 3 SVC plus IVC. And essentially, if you plug the numbers in from before and do the math, you get 2.0. All right, that was a tough one. All right, Tucson, you still have the board.
Same category, 400, please.
The pulmonary artery pulsatility index, PAPI, can be used to evaluate RV failure in cardiogenic shock. This is the equation used.
Tucson,
What is pulmonary artery systolic pressure minus pulmonary artery diastolic pressure over right arterial pressure?
Right. Sorry, can you clarify that last one?
Right arterial pressure, RA pressure.
Yeah, right atrial pressure. Olivia, are you okay with right? Did he said right arterial pressure, right?
Pressure.
Did he say right arterial pressure or right atrial pressure?
I said both, but
Yeah, okay. All right. You said the second time. All right, fair enough. Olivia, yes. All right. Right, that's right. Yeah, it's right atrial pressure, not right arterial pressure. But yeah, PA systolic minus PA diastolic over right atrial pressure. All right, Tucson.
we'll take CV smorgasbord for 100.
CV smorgasbord for 100. All right. A 70-year-old female with colon cancer, coronary artery disease, hypertension, atrial fibrillation presents with hypotension and septic shock during hospital stay and was found to have this ECG. Please discontinue this medication she has been on at home. Her kidney function is getting worse.
Tucson,
What is digoxin?
That's correct. Yeah, that's bidirectional VT, and that is digoxin. This is a classic finding.
Can I just ask a quick question?
Yes.
Can you tell us who's the buzz ordering that? Because we've been buzzing right away for some reason we get beaten every time.
Are we being
It's too
seen?
fast.
Yeah, no.
man.
Everything the same. I think it's the same for us as well.
yeah, the rank is Tucson, Mayo, and then Phoenix.
Okay.
Does it give you times as to the buzzing?
It does not.
Okay.
Because
that
we're buzzing as soon as it turns red, but I guess I mean a not fair game, but I'm just trying to make sure that everything's okay on our end.
Yeah,
No,
that's why.
that's why they rank it, so that It's not just me eyeballing it. It's
Yeah, why don't you read it out as well when you let's read out all the ranks, just so we make sure there's not some sort of persistent problem. Okay.
Sure.
But yeah, we did. That's why we ran all those tests before we started. All right. Tucson.
Same category, 200, please.
TV Smorgasbord. This Agatston score can be used to define severe aortic stenosis in patients with low flow, low gradient, severe aortic stenosis with normal LV function. The values for women and men are different and we'll accept either.
Tucson was first, then Phoenix, then Mayo.
What is 2,000 for men and 1,200 for women?
Let's see. You said 3,000 for men?
2,000.
No, we said 2,000.
2,000. Okay, 2,000 men. Okay, good.
We said 2,000 for men and 1,200 for women.
Yeah. These guys went for 1,300, but I've definitely heard the 1,200 as well. So I think that's reasonable.
1,200.
Wait, did we get that wrong then? Because it says
No, you got it right. For some reason, this thing didn't go off. I pressed the wrong button. You are correct.
Oh, it's just the number is just okay.
No, you got it right. Yes.
Okay, we'll do the same category for 300, please.
Yeah. This value is the potassium cutoff, where spironolactone.
Sorry, we can't see the question. Oh, now it came up for some reason.
Okay, I'll start reading again. Give you time. This value is the potassium cutoff, where spironolactone should not be initiated for adjunct class 2 heart failure therapy in HFrEF with ejection fraction less than 35%.
Tucson, then Mayo, then Phoenix, then Honor Health.
What is greater than 5.5?
Yeah.
5.5.
What is greater than 5.5?
Okay, that is incorrect.
Okay. Second was Mayo.
Mayo?
What is 5?
Yeah, that's correct. Yeah. Mayo is blue, right? Yeah. Okay. All right, Mayo, you have the board.
We'll do CB Smorgasbord for 400.
This echocardiography scoring system is useful to determine the likelihood of a successful balloon valvotomy in mitral stenosis.
Tucson, then Phoenix.
What is Wilkins score?
Yeah, that's correct. Yeah, the Tucson internet is very fast, or the Tucson phone is very fast, or the Tucson...
For some reason, when you start reading questions, our screen kind of shows up the question like 2 or 3 seconds later also. But I can hear your audio, you reading a question, but it may be our internet.
Okay, so maybe we'll pause every time I'll do the question, and I will pause for a while before it goes live, okay? Wave at me when you see it, just to be fair. All right, Tucson.
Let's do HIV for 200, please.
Okay. A 45-year-old patient with HIV on antiretroviral therapy has a...
Can't see the question still.
Okay,
Now we see it. All right.
Okay, start again. A 45-year-old patient with HIV on antiretroviral therapy has a prominent diastolic murmur on exam. The disease process shown is characterized by the occlusion of this layer of the structure in the images. I'm going to put the timer on. Okay, so nobody answered that. That's HIV-associated aortopathy, and the layer that's involved is the vasorum. Right, that's the national answer to the question. Tucson still has the board, given the...
Same category for 300, please.
Okay. Phoenix, let me know. Wave. Okay. The randomized trial to
You
prevent...
can't see it. Sorry.
Yes?
No,
You wave
not yet. Not yet. No. Now we can. Yeah.
Okay. The randomized trial to prevent vascular events in HIV, the REPRIEVE trial, was launched with support from the NIH, NIAID in 2015 to study the effect of this drug class on reducing MACE in patients living with HIV.
Phoenix.
What is pitavastatin?
Yeah, that's correct. Yep. It's statins, but yeah, specifically pitavastatin. Good job. Phoenix.
Sorry, we are waiting for the board to show up.
Yeah. Okay.
We still see your answer. Waiting for the next one.
Oh, this is
No, we
weird.
can't. Okay. We'll take. I see. It's IC
Okay. For what?
for 100.
Spontaneous coronary. Okay, I gotta wait for you. Can
Yeah,
you see-
we can't see it. So.
This is very.
Is it just
Yeah,
us?
I don't. Probably it's. I don't know. It's our internet or something. But
All right.
yeah,
Can you see it?
Yeah.
now we can.
Okay. Spontaneous coronary artery dissection occurs most commonly in this coronary artery.
Mayo.
What is the left anterior descending artery?
That's correct. What is the LAD? Mayo, you have the board.
We'll do same category for 200.
Okay. Let me know, Phoenix, when you can see.
Yeah, we still cannot. We are still on the
Okay.
answer here. See the board now. Now we can see the question.
All right. IV cangalor is being infused in a patient with a STEMI. To ensure absorption, only this approved antiplatelet can be given while cangalor is being infused.
Tucson.
What is ticagrelor?
That's correct. Yeah, it's a very common question. Tucson, you have the board.
Same category, 300, please.
So clicking here. Let me know when you can see the board.
Yep,
Thanks.
we are waiting. We see the answer now.
Okay.
Now we see
In
the
the,
board.
you can see it? Yeah.
On the board, not the question yet.
Okay. That's very strange that your
Yeah,
sound
now
is
we see the question.
in the appropriate use criteria for PCI in 3-vessel disease, what syntax score is used to define low disease complexity?
Phoenix.
11. What is 11 or less?
That's incorrect.
Honor Health.
What is 22?
That is correct. Honor Health has that. Okay, yeah. Just remember, you're right to think it was multiples of 11. The difference is 22 and 33 are the cutoffs. So low is 22 and less, the high is the 33 number. Honor Health.
Okay, let's do IC. It's IC for 400.
Okay, Phoenix, let me know. I'm waiting for you.
Yeah, we are waiting for the board.
This is a very special problem.
Sorry.
This is hospital Wi-Fi banner for you.
Ouch.
All right, we see the question now.
Okay, this scoring system is commonly used in evaluating a patient for PFO closure for cryptogenic stroke. It may assist in determining the likelihood that the stroke was related to the presence of the PFO.
Mayo.
What is the rope score?
That is correct. The rope score. Yeah, the elements are hypertension, diabetes, history of stroke or TIA, smoker, and then cortical infarct imaging, and then you show in the age as well.
Oh, and I'm sorry, I just realized that I'm off on 300 with Phoenix.
Oh, really?
You have 300 for Phoenix and I have 600.
Oh, really? Okay. When did that start to go off?
1, 2, 3, 4, 5 questions ago.
Don't forget, they just had a negative score from their from the answer for the what you call it, the syntax score. Do you have
Yes,
that?
you are correct. I do not have that one. So maybe
Okay.
it does wash out.
Yeah, it does.
Okay,
All right.
thanks.
So there's only one more option on the board. I'm going to click it. All right. Phoenix, let me know, because this is a picture one. You have to see this.
Yeah, we still see the board.
Goodness. We'll do this on Teams next time. Be even worse.
Yeah.
All right, we see it.
Okay. A 45-year-old woman presents with symptoms of cardiac tamponade. She has been living with untreated HIV for many years. Imaging reveals the following. Histology would prove this to be this primary cardiac tumor.
Honor Health.
What is rhabdomyosarcoma?
No, that is incorrect.
Mayo.
What is lymphoma?
That is incorrect.
Phoenix.
What is angiosarcoma?
That's also incorrect. Tucson, not biting. Okay. So this is a Kaposi sarcoma, specifically to HIV untreated for many years patient. Okay. Trying to remember who has the board. So we're going back to the board. We are moving on to the double board right now. But before I enter the double board, let's clarify who had the last board. It was Mayo, right? It was Mayo. They had the last. Okay, so Mayo has the board. We are moving on to the double screen. All right, Mayo.
Pump you up for 200?
Pumps you up for 200. The gold standard for diagnosing myocarditis is?
Mayo.
What is endomyocardial biopsy?
That's correct. Okay. Mayo, you have the board?
Do the same for 400?
Okay, pump you up for 400. In the first 8
Hold
weeks.
on, Dr. Lee. Can Phoenix see the question?
Yeah, sorry, yeah. Can Phoenix see?
Not yet. Now we can.
Okay. In the first 8 weeks of initiation of this heart failure medication, NT-proBNP is the preferred measured cardiac biomarker and not BNP.
Phoenix.
What is sacubital valsartan?
Yes, that is correct. This is a close game. Very exciting. Phoenix.
Sorry, we're waiting for the board to pop up.
Okay.
All right, we'll go the same for 600.
All right, 600. An 85-year-old man with shortness of breath has normal LV
Sorry,
ejection
one
fraction.
second. Sorry,
Okay.
sorry to interrupt you.
Yep. Sorry.
All right,
It's
now
hard
we can.
It's hard to time travel. An 85-year-old man with shortness of breath has normal LVEF and the tissue Doppler shown below. The most likely diagnosis is?
Mayo.
What is restrictive cardiomyopathy?
Olivia, what do you think?
Or cardiac amyloid.
Or HFpEF?
Cardiac amyloid.
Amyloid.
Yeah, I think that's acceptable. They're looking for cardiac amyloid, but you can argue that restrictive cardiomyopathy is a diagnosis upon itself, right? So it's just a subset that's most likely in this man is cardiac amyloid. So we'll accept that. That was Mayo, right? Okay. All right. Mayo.
Same one for 800?
All right.
We're still
Phoenix?
waiting. Yes.
Yeah. Phoenix, can you see?
Yeah, I'll let you know when we see it.
Okay.
Now we see it.
Okay. Neutropenia, muscle weakness, and the echo findings below are consistent with this syndrome.
Phoenix.
I'll put the timer, Phoenix. Can't buzz. You have to answer.
Yeah.
What is low efflux syndrome?
No, that is incorrect.
Honor Health.
What is cardiac non-compaction syndrome?
That is incorrect. It's not specific enough. Non-compaction is part of the syndrome.
No one else has buzzed in.
Okay, and we'll put a timer. If timer passes. Okay, so it's correct to recognize that there is non-compaction, but this is a very specific syndrome that has neutropenia and muscle weakness as well. And the answer is BARF syndrome. I never heard of it before this. Somebody from UCLA knew the answer, which was amazing. But they also have congenital fellows in their team, so that's amazing. All right, so nobody got that right. Who had the board? Was it Phoenix or Mayo? Can't remember.
Or 200.
Yeah, it was the last one.
It was
Okay, Mayo for 200. Which one?
Yeah, pictures worth for 200, please.
Okay. All right, Phoenix, let me know. These are pictures, so it's even more important that you can
We're
see.
just waiting for it.
Yep.
All right, we can see now.
Okay. A 35-year-old Asian man presented with dizziness, presyncope, and a murmur. An echocardiogram was performed, which shows this abnormality.
Phoenix.
What is left atrial myxoma?
That's correct. Okay. Phoenix.
Sorry, waiting for the board to come.
Yep. Is Tucson buzzing in, Megan? We haven't heard from them for a while.
They are. They were
Yeah.
after Phoenix, the second.
Maybe internet speeds are going back and forth.
Right, we see the board now. We'll take the same category for 400. And I'll
400.
let you know as soon as we see it.
Sure.
All right, we can see it.
Okay. A 70-year-old had repair of traumatic pelvic fracture, then became hypotensive with AFib and RVR. She was shocked but did not convert. On transfer to ICU, she required vasopressors and was intubated. An echo was obtained suggestive of what cause of her acute illness.
Phoenix, then Tucson, then Mayo, then Honor Health. So
Okay,
Phoenix
perfect.
first.
What is acute pulmonary embolism?
Yeah, we'll accept that. The Nationals had a
Fat, yes.
Yeah.
Yes.
yeah, the Nationals, well, but we'll accept PE. It doesn't, both of them would have created the same picture. So Phoenix, okay. All right, Phoenix, you still have the board.
Just waiting for, okay. We'll take the same category for 600.
A 47-year-old male in
One second, sorry.
No.
All right, we can see that.
A 47-year-old male in northern Colorado with prediabetes, hypertension, and long-standing alcohol abuse had sequential ECGs. This ECG finding was noted on taking, or this finding was noted on taking his vitals at admission.
Mayo.
What is hypothermia?
Yes, that's correct. Good job on picking up the subtlety that they're not asking for Osborne wave, they're asking for hypothermia. Yep. Okay. Mayo?
Same category, 800, please.
Okay.
I'll
A
let you
60.
know as soon as-
Okay, I'm waiting.
All right, we're good.
Okay. A 65-year-old man with multi-vessel CAD had CTO intervention of the left circumflex. During PCI, he became hypotensive. Repeat contrast injection of the circumflex is shown, followed by echo, including contrast microbubble injection into the circumflex. So there's two diagnoses that you need. This is what happened.
Honor Health.
What is a coronary perforation?
I'm going to give you a chance. There's two diagnoses that I need. I did read that out earlier. Two diagnoses.
What is a coronary perforation extending into the left ventricle?
Yes, that's correct. Yeah, that's what you're seeing here. You have to have The perforation by itself is here, but this with the bubbles coming through shows that, you know, it's actually traversing into the left ventricle. So it's coronary cameral fistula and coronary perforation is the right answer. Good job. Did I give them the thing? No, hold on. I got to go back to the board. Give me a second. I need to give them the points. Okay. All right. Honor health.
Let's do cards 101 for 200.
Phoenix, let me know.
Yes. Okay, we can see.
Okay, thiazide diuretics can result in what abnormality in a lipid panel?
Tucson.
So what is elevated triglycerides?
That's correct. What is hypertriglyceridemia? You're back. All right, Tucson.
Same category 200, or same category 400, please.
Okay. These are the 4 components of the metabolic syndrome. All 4.
Phoenix.
Go ahead, Phoenix.
The pre-diabetes.
What is hypertension?
Mhm.
Pre-diabetes,
Mhm.
hyperlipidemia, and obesity.
Yes.
Olivia, what do you? No, you got to be a little bit more specific.
So you mean on just the obesity part or elevated BMI?
I can't give that away.
Okay, what, I mean, waist circumference. Increased
Give them one chance to be more specific.
Okay, one chance more specific. I can't give you more hints because it will give, then the other teams will.
So I guess what is hypertension? What is hyperlipidemia? What is prediabetes? And what is increased waist to truncal ratio?
No, sorry, Phoenix. I can't give you that one.
Honor health.
What is waist circumference, fasting glucose, hyperlipidemia, and hypertriglyceridemia?
You repeated yourself twice there.
Oh, sorry. And do you want me to back away or
Yes.
start again?
Do it again. I'll give you I want a chance to do it again.
Okay. What is fasting glucose, waist circumference, hyperlipidemia, and
Okay. That has to be wrong. Okay. Anybody else?
Tucson Busden.
All right.
So what is waist circumference? What does that say? Oh, hypertension, impaired glucose tolerance. And what was the last one?
This is triglycerides.
Where do you say triglycerides? Right? Yeah.
Triglycerides.
Wait, hypertension, triglyceridemia, waist
Impaired-
circumference, and impaired
impaired
glucose tolerance.
Yeah. So sorry, Phoenix, that you have to specifically, it's not just all hyperlipidemia. Hyperlipidemia might just be LDL increase. It has to have hypertriglyceridemia. That's very specific, right? The metabolic syndrome. And then honor health, you missed hypertension. They had it earlier. Yeah, your hyperlipidemia, hypertriglyceride came twice. The same thing. Okay, Tucson.
We'll do same category 600, please.
This is the preferred imaging modality to diagnose intramural hematoma of the thorax. Oh wait, Phoenix, can you see? I'm sorry, I'm gonna stop.
Yeah, we can see. We can see.
Okay. This is the preferred imaging modality to diagnose intramural hematoma of the thoracic aorta.
Mayo.
What is CT?
Yeah, that's correct. All right, Mayo.
Cards 101, 800, please.
That's 1-1 for 800. Oh, it's a daily double. So this is yours. Reminder again, you have to wager. You can wager the maximum $2,300, and then you must answer right or wrong, and you will get exactly what you have wagered or lose exactly what you've wagered. What is your wager?
We'll bet 200.
200. The V wave on pressure tracing follows which V wave on the EKG?
What is the P wave?
No, that's incorrect. It is actually the. Wait here.
What?
Oh, that didn't work. Okay. So it's the T wave. It's weird. It's I had to sit and think about this for a very, very long time. But yeah, if you actually work it out, it's actually the T wave from a timing perspective. I need to adjust that, right, Olivia? It was 2100. How do I
You've
adjust
already adjusted because they were at 23. They
Okay.
wagered 200 and now they're at 21.
All right. Okay. Mayo, you still have the board.
Rhythm's gonna get you at 200.
Okay. Which class of antiarrhythmics are contraindicated to suppress asymptomatic ventricular arrhythmias after acute MI? Phoenix, sorry, can you see? Yeah.
Phoenix already buzzed in.
Okay, Phoenix, buzz in.
What is class 1C?
Correct, that is correct. Good job. All right. Phoenix.
Or we'll take the same category for 400.
Okay. Okay, this one, I'm gonna modify this a little bit because I think this needs to be a bit more specific. Atrial fibrillation incident doubles with every 10 unit increase of this demographic variable in the population.
Mayo.
What is age?
Yeah, that's correct. Mayo, board is yours.
600 for rhythm's gonna get you.
Phoenix,
Waiting.
can you see?
Not yet. Now we
Yeah.
can.
Okay. Unlike other class 3 agents, this antiarrhythmic agent increases the defibrillation threshold of AICDs.
Tucson.
What is amiodarone?
That's correct. Okay. Tucson, what is you?
Same
what is
category,
yours?
800, please.
Okay. This genetic mutation of LQT1 syndrome. Oh, I'm waiting for Phoenix.
Yeah,
Still
we
waiting.
still can't see it. Now we can.
This genetic mutation of LQT1 syndrome predisposes patients to the following rhythm.
Mayo.
What is KCNQ1?
Yes, that's correct. KCN21. All right, Mayo.
Different strokes for 200.
Okay, I'm waiting. Phoenix, let me know.
Yep, we see the board now. All right, we see
Okay.
it.
Yeah, this cardiac space is a derivative of the atrial primordium. In adults, it can have many different types of structures. It arises as an extension of the embryological pulmonary vein bud.
Mayo.
What is the left atrial appendage?
That's correct. Okay. Mayo?
400, please.
Oh, daily double again. Your wager?
We'll do 200 again.
Okay. A 64-year-old woman presents with right hemi anesthesia. Her bedside TEE done for a soft diastolic murmur shows the image pictured. This characteristic of this finding would indicate a favorable risk benefit for surgery. Put on a timer here.
Limited size, maybe.
What is limited mobility?
No, it's a size criteria. So I'm gonna subtract that. And then show you the answer. It's basically the size criteria of, you were right, but they needed specifically the exact size criteria.
Isn't it either one of those? Or no?
Sorry?
Okay. I thought the answer was maybe either one, but okay, it's fine.
No, it's not. It's both. Hold on. Why is it still live? Okay, 400 is taken up already. It's done. All right. So Mayo is choose between 600 and 800.
600, please.
Ticagrelor is associated with a
Sorry, one
Phoenix.
Yeah.
Yeah.
sorry.
Okay. Phoenix. Good.
Not yet.
Okay.
No.
All right, we're good.
All right. Ticagrelor is associated with a significantly lower incidence of ischemic stroke and all-cause stroke when compared with this other medication.
Honor Health.
Honor Health?
What is Prasugrel?
No, that is not the answer.
Tucson.
Tucson?
What is clopidogrel?
Yeah, that's correct. Yeah, there's a Euclid trial. Yeah, that's a strange fact. All right, last one.
Wait, did you give them the
Wait.
600?
Yeah, I don't think we got points for that.
Okay, let me go back. Okay, got it.
Then, we'll do the 800.
Yeah, that's the last one. All right, I'm waiting for the board to be
Yeah,
seen by Phoenix.
Yeah, we're not yet.
This is important because of the picture.
Yeah, we see it now. Yeah.
Okay. A healthy 20-year-old woman presented with sudden onset left face and arm weakness and hyposthesia. MRI of the brain showed a right MCA infarct. This bedside echocardiogram and stat non-contrast CMR suggests what genesis for her acute illness?
Phoenix.
What is non-compaction cardiomyopathy?
Yes, that's correct. All right, good job. Okay, well done. We are now moving into final Jeopardy. I'm going to go a bit slower just to make sure that the Phoenix group can keep up, okay?
Dr. Lee, do you mind reviewing the rules for Final Jeopardy before we
Yes,
start?
yeah, sure. Okay, so the category is ECG, okay? You now have to write down a wager and you need to commit to that wager before you see the question. The maximum you can wage is the maximum in your bank account, okay?
What about for Honor Health?
What's that?
What
No,
about
Joe,
for our Honor Health?
Yeah, they won't be able to wager, unfortunately, because it's unfortunately negative.
Is this just one question?
It is just one question. So we will show you you write down your wager. We show you the question. You don't call it out, all right? Everybody has to answer. We will look at everybody's answers. You have to write down the answer after a, we'll give you 30 seconds or whatever. But you have to write down the answer and then put that piece of paper down, and then we will show you the answer, and then everyone will look at the answer, and then they'll either get plus or minus depending on what happens. Okay. Okay, ready? Right, and I'll go slow once again because of Phoenix's problem.
Sorry, should we already wager now, or what's
Yes.
the rules? I'm sorry.
Yes, you need to wager. You need to have done that. Can you please make sure? I'm going to call it out. Everybody has wagered.
Write down 2,300, I guess.
23?
Yeah.
22, right?
Okay. Did you write your wagers down? Wave at me, please. I want to see confirmation. Tucson, are you good? Yes. Mayo is good. Sorry, Honor Health. You guys were close. All right. I'm going to move. And okay, I'm waiting for Phoenix. Phoenix, can you see? Yes?
Yep.
Okay. An intervention was performed for an acute diagnosis in this 31-year-old man with chest pain, nausea, and vomiting. An ECG on admission on the left was shown, and after 4 hours is shown on the right. He was treated, and the answer is we're looking for is what is the diagnosis? Okay, I'm going to give you 10 more seconds to write down your answer on that piece of paper. Ten, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, let's see some answers. Tucson, what is your answer? And what is your wager? Can you show us? I can't see. $2,700. What is hyperkalemia? That is correct. Okay. Yep. All right. Phoenix, can you show us your? I can't see. Show us. Phoenix, can you show us your wager and your answer? So $700 wager. Okay. What is your answer? What is anterior STEMI? Okay, that's incorrect. Okay. That EKG is definitely not a STEMI EKG. It's a very, very broad, very abnormal V1, V2, V3. Yep. Mayo, what you got? I can't. Oh my gosh, you gotta shine it. You should. The light is terrible. Tell what it is.
We wrote down 2,200 and hyperkalemia.
2,200 and hyperkalemia.
Yes.
Okay, so Olivia, you have to do the math. So it's.
They did the math already. Mayo wins by 100.
100. Wow.
Strong work,
Okay.
gentlemen.
All right. Congratulations, Mayo. You will be representing Arizona for the ACC Nationals. You know, I have to say, guys, I'm sorry for that strange delay. I feel like it may have put Banner Phoenix back a little bit, but I'm super impressed by all the 4 teams here. At some point, people looked like they were going to surge, and there were just some unfortunate negative questions there that got in the way. But really, this is great to see all the fellowships, performing so well. Congratulations, everyone, for taking the time as well, out of your busy Sundays to be with us. And I'm just stoked to see all you guys and how well you're doing, and hopefully come participate and join us with ACC, and be active and be part of the FIT committee and stay with ACC. We hope that this will help you feel connected to us and have a lifelong relationship with the ACC. Don't forget that in the fall we hope to have our first in-person meeting back again, and at those meetings, the abstract competitions, they used to be extremely well attended. The last 2 years we've had to go virtual, and that's the attendance has definitely fallen off, and the participation has definitely fallen off. We really want to see you back, and we'll have prizes for you, thank you. Yeah, Olivia, you want to close up first?
Congratulations to Mail. You guys played a wonderful game, and we look forward to having you guys represent us at the Nationals. Tucson, you guys came close and gave it for all you had, so congratulations as well. And Phoenix and Honor Health, the buzzers were a little bit against you, and the video was a little bit against you today, but thank you all. You guys really made this a great and a lot of fun. Thank you, Dr. Lee.
Next year in person, so we can watch people hit those buzzers. No more digital stuff.
Yeah.
Can't blame Cox anymore. All right. Bye.
Thank you, Con, for
Great job,
hosting.
everybody.
Thanks, Dr. Lee.